without further ado, let's jump in and look at life before eVisit, called LBE. So, time machine me back 5 or 6 years, Greg. What did your first efforts look like for digital care? Did you do this in house? Where did that first iteration come up short? And what were some of the problems you were looking to solve when you started looking at other solutions? And do have a bonus question here, and I did give you a heads up that this was coming, so which is good. But if you
Love it.
knowing what you know now, if you could go back in time, um, what would you tell, well, after you bought a Powerball ticket, if you could go back in time, but what would you tell the implementation team when they were implementing the solution? What were some of the challenges that you could avoid, or what advice would you give them? That was a lot of lead up. So let's, yeah, life before eVisit, I think, is what we're getting at here.
Okay. All right. So yeah, a lot to unpack from this series of questions here. But going back 5 and 6 years, I think everybody remembers what was going on during 2020 and 2021 was the COVID pandemic. Really accelerated the utilization of telemedicine. It thrusted it into a sort of a need now instead of kind of like a sideshow type environment that I think telemedicine existed in previously, where we definitely obviously wanted to meet patients at access points where it was valuable to them. But certainly once people were being asked to stay home and to keep their coughs and sneezes to themselves, telemedicine really became a viable product for everyone to use, especially for low acuity care and the type of stuff that we really see in the pediatric space more and more, which is essentially a tremendous amount of viral upper respiratory infections. So going back, clearly at that point, we were pressure testing everything that we had done prior to that point in time. And volume obviously spiked very quickly. So not, again, that I don't think anybody could have foreseen that event, the COVID pandemic necessarily coming into play and causing us to need to sort of evaluate our systems, our processes, scale up very quickly to support our practice and remain profitable, which I'm sure anybody that's listening to this today is going to obviously have some sort of an obligation to remain profitable in their line of business. But we really, at that point, had to challenge our current vendor on the technological front of what could they do and how rapidly could they do it to sort of pivot and flex with our needs as an organization. So the brainstorming and the sort of conceptual version of what we wanted KidzDocNow to look like was in-house. It was determined in-house by our leaders of this department of organization. We really talked extensively to our local market leaders, which was my role at the time here in North Florida, talking about what are our current needs, where are we struggling to treat patients. It wasn't necessarily even at that point that patients had to stay home. Clinicians had to stay home too at times if they had qualifying symptoms. And we wanted to see if there was a way that we could provide end-to-end care, peer-to-peer connection for a clinician and a patient who's not able to come to the office at the same time. So lots of these challenges obviously were coming up all at once. And when we were obviously in constant communication with our current vendor, bringing them our problems, asking them for solutions, we were met with what we have seen with some other vendors we do business with and other spaces of sort of like dealing with bundled box technology that's not very customizable. And that really was, at that point, a barrier for us to provide more services quickly and also deliver them sort of, here and now, not waiting days, weeks, months, or years for that sort of technology to be available to us. So we found that was a real shortcoming, obviously. Internally, within the scope of and span of our own controls, we really took what we knew and we had learned from our previous 5+ years, because we were doing telemedicine 10 years ago here at Pediatric Associates, which I think we were really trailblazers and pioneers in that space. There wasn't too many other practices doing this, but again, we're a big powerhouse practice in Florida. We have a lot of market share here, and we are a value-based care company, so we really prioritize the right care, the right delivery method, the right cost, sort of all in one package to our patients and to our payers. So telemedicine naturally, as we evolved in the value-based care world, came as sort of just a needed thing. We need to have a lower cost option for lower acuity patients to receive care now, not to interrupt their day, not require them to spend 2 or 3 hours at the office. Payer partners offering them a much lower cost solution to treating these patients.